Let's talk about the drugs which are used in hypertension. Hypertension is recognized as a major risk factor for several potentially lethal cardiovascular conditions, including MI, heart failure, and stroke. Guidelines urge more active prevention and treatment of hypertension. According to the guidelines, average systolic pressure greater than 120 but less than 130 mmHg is elevated. However, the blood pressure which is greater than 130 by 80 but less than 140 by 89 mmHg is stage 1 hypertension, and that which is greater than 140 by 90 or equal to 140 by 90 is considered to be stage 2 of hypertension. Increased systolic pressure is now considered as at least as important as elevated diastole. Both stage 1 and stage 2 of hypertension are deserving of treatment in most patients, and the guidelines are that cause and treatment of atherosclerosis should be considered. Many drugs are available for the treatment of hypertension, and in most patients, blood pressure can now be controlled effectively and with minimal adverse effects. Anti-hypertensive drugs are organized around a clinical indication, need to treat the disease rather than a single receptor type. The drugs covered in this unit have a variety of mechanisms of action, including diuresis, sympathoplegia, interference with the SNS, vasodilation and antagonism of the renin, angiotensin, aldosterone system, and many agents are available in most of these categories. Now let's talk about the drugs which we use in hypertension. They can be classified according to 4 groups. First group is that of diuretics. The second group is that of sympathoplegic blockers or sympatholytics. And the third group is that of vasodilators. And the fourth group is that of angiotensin antagonists. Now for the diuretics, they are going to reduce the blood volume. And these include thiazides, which includes hydrochlorothiazide, and loop diuretics like furosemide, and potassium-sparing drugs like spironolactone. Then we have sympatholytics, which include alpha blockers, beta blockers. In alpha blockers, we have prazosin, and in beta blockers, we have propranolol. And then we have nerve terminals, ganglion-acting drugs, and CNS sympathetic outflow drugs. So for the nerve terminal drugs, we have guanethidine and reserpine. For the ganglia, we have hexamethonium. And for the CNS sympathetic outflow drugs, we have clonidine as well as methyl-dopa, which is safe in pregnancy-induced hypertension because it is an alpha-2 agonist, and it can cause hemolytic anemia and gives a positive Coombs test. For the ganglia drugs, remember hexamethonium as well as trimethophan. They are also used in controlling CNS diseases like Rett syndrome. And for the nerve terminal drugs like guanethidine, please remember that they can cause seizures, so they were contraindicated in the past. They were discontinued. Then we have alpha or beta blockers. They will reduce the sympathetic tone. And then now let's talk about vasodilators. Example is that of minoxidil, which we use a lot these days for aesthetic purposes. And then they are going to lower the peripheral resistance. So vasodilators will lower the TPR, total peripheral resistance. They will also cause relaxation of the smooth muscles. And then for the vasodilators, we have older oral vasodilators like hydralazine, and we have calcium blockers like nifedipine, and then we have parenteral vasodilators like nitroprusside, which acts on arteries as well as veins, which is arterial plus venous. For the calcium blockers, please remember dihydropyridines as well as non-dihydropyridines. For dihydropyridines, we have nifedipine, amiodipine, which acts on the vessels, and the non-dihydropyridines like verapamil and diltiazem, they act on heart plus vessels. Now let's talk about the angiotensin antagonists. These include ACE inhibitors like captopril, and also receptor blockers like losartan. These are the angiotensin receptor blockers. They do not cause dry cough because they do not increase bradykinin. They block the AT1 receptors, and they prevent angiotensin 2 from causing vasoconstriction and aldosterone release because RAS is going to be inhibited. And then we have ACE inhibitors, receptor blockers, as well as renin inhibitors. Renin inhibitors include aliskiren,